These abbreviations are used during the video.
Sonographic evaluation of a biceps tendon rupture can be difficult due to synovial proliferations or adhesions of the tendon in the sulcus. Therefore, the myotendinotic junction should be always examined as well. The myotendinotic junction, also known as MTJ, lies behind the pectoralis major tendon. In an horizontal sonogram, it has a horseshoe shape. The starting point lies 0 to 2 centimeters distal from the upper border of the pectoralis major tendon. Distalization of the horseshoe sign indicates biceps tendon rupture. The anatomy is now shown on the cadaveric specimen. The origin of the pectoralis major muscle is cut and reflected laterally. The myotendinotic junction is situated between the two broad tendons of the pectoralis major and latissimus dorsi. The starting point is marked with the red star and the ending with the red triangle. The myotendinotic junction is formed by a superficial aponeurosis on the lateral side. On the medial side, the muscle fibers extend much further proximally. Before the transition, the biceps tendon flattens out and displays a medial notch. In a transverse dissection, the aponeurosis has a horseshoe shape with its opening facing medially. Towards distal, the horseshoe becomes larger and thinner and the muscle more prominent. For the examination, the patient is positioned seated with the arm hanging alongside the body in slight external rotation. The transducer is placed horizontally over the proximal part of the bicipital groove. Identify the round biceps tendon between the lesser and greater tubercle. From here, we follow in a lift technique the biceps tendon distally till it becomes flat. The flat biceps tendon displays a notch on the medial site. Dorsal to it, the insertion of the latissimus dorsi tendon can be seen. From here, the probe has to be moved very slowly further distally till the tendon of the pectoralis major will be seen. Behind it, the horseshoe sign will arise. The horseshoe of the MTJ has its opening to the medial side. The adjacent muscles are the short head biceps and the coracobrachialis. As the probe is moved further distally, the pectoralis major tendon disappears. At the level distal to the pectoralis major tendon, the two muscle bellies of the biceps are clearly visible. This is the place where to assess long biceps tendon rupture. Due to tendon retraction, you will find the horseshoe sign here. In the next scene, you see a longitudinal view of the myotendinotic junction by turning the probe 90 degrees. In the long axis view, the long head biceps tendon and its MTJ appear as a Y-shaped structure, with its arms pointing distally. The muscle fibers of the long head biceps are located between the subtle arms of the aponeurosis. In the case of biceps tendon rupture, you will find the horseshoe sign distal to the pectoralis major tendon. In this example of a chronic tear, you will also see the muscle atrophy. In the longitudinal axis, the transition from the dystrophic to the normal muscle can be seen between the subtle arms of the aponeurosis. The retraction of the ruptured biceps tendon can be measured. In this figure, a mark on the skin is set at the level of the dislocated horseshoe, number 2. The first mark was set at the level of the upper border of the pectoralis major tendon, number 1. By measuring the distance, you can evaluate the dislocation. The physiological distance is 0 to 2 centimeters. Here, it is more than 4 centimeters. The exact amount of retraction can be determined by comparing the sides. On the healthy left side, the distance off the beginning of the horseshoe to the upper border of the pectoralis major tendon is 1 centimeter. Therefore, the absolute retraction of the ruptured biceps tendon on the right side is about 3 centimeters.